Gonorrhea is a sexually transmitted infection, which means it spreads from one person to another most often during sexual activity. This can happen between people of any gender or sexual orientation, and it doesn't matter if you're in a long-term relationship or if it's a one-time encounter. The bacteria that cause gonorrhea are highly contagious and can be passed on even if you or your partner feel completely healthy. Gonorrhea can be transmitted through any kind of sexual contact, including vaginal, oral, and anal sex. It's important to know that you don't have to have penetrative sex to be at risk. Any direct contact with infected genital fluids or mucous membranes can allow the bacteria to spread. The bacteria responsible for gonorrhea, called Neisseria gonorrhoeae, can enter the body through the delicate linings of the genitals, mouth, or rectum. Even a small cut or abrasion in these areas can make it easier for the bacteria to infect you. This is why using protection, like condoms or dental dams, is so important during any kind of sexual activity. It's a common misconception that you have to have frequent sex to get gonorrhea. In reality, it only takes one sexual encounter with an infected person to contract the infection. Even if it's your first time, or if you think you know your partner's sexual health status, there's still a risk. What makes gonorrhea especially tricky is that you can get it from someone who looks and feels perfectly healthy. Many people who have gonorrhea don't show any obvious signs or symptoms, so they might not even realize they're infected. In fact, it's estimated that a large percentage of people with gonorrhea are completely unaware they have it. They can still pass the infection to others without knowing, which is why regular testing is so important, especially if you have new or multiple partners. Getting tested for gonorrhea and other sexually transmitted infections is a simple and confidential process. If you're sexually active, especially with new partners, routine screening can help catch infections early and prevent them from spreading further. Gonorrhea doesn't just affect adults. Sometimes, a pregnant woman who has gonorrhea can unknowingly pass the infection to her baby during childbirth. This is why prenatal care includes STI testing, to help protect both mother and child. If a newborn contracts gonorrhea during delivery, it can lead to serious health problems, such as eye infections or even more severe complications. Early detection and treatment are crucial to keep both the baby and the mother healthy. The good news is that gonorrhea can be treated effectively with antibiotics. That's why it's so important to seek medical care and start treatment as soon as possible if you think you might have been exposed. It's also important to clear up some myths. Gonorrhea cannot be spread by sharing towels, using public toilets, hugging, or casual contact. The bacteria don't survive well outside the human body, so everyday activities pose no risk. Remember, gonorrhea only spreads through sexual contact or from mother to baby during childbirth. Practicing safe sex, getting regular checkups, and having open conversations with your partners are the best ways to protect yourself and others. Gonorrhea can cause different symptoms in men and women. In men, the most common sign is a burning feeling when urinating. There might also be a white, yellow, or green discharge from the penis. Some men feel pain or swelling in their testicles. Women can have a burning feeling when they pee, too. They may notice increased vaginal discharge that looks yellow or green. Some women have pain in their lower belly or when having sex. It is important to know that symptoms can be mild. Sometimes, people think they have a bladder infection or another problem. This makes it easy to ignore gonorrhea. If you have any of these symptoms, talk to a doctor. Getting tested is the only way to know for sure. Gonorrhea is a sexually transmitted infection that most people associate with symptoms in the genital area, but it's important to know that it doesn't always stop there. While many people are familiar with the more common signs, such as pain during urination or unusual discharge, gonorrhea can sometimes affect other parts of the body in ways that are less well known. Sometimes, the bacteria responsible for gonorrhea can travel beyond the genitals and show up in unexpected places. This can happen through different types of sexual contact, or even by accidentally transferring the bacteria to other areas. For example, if the bacteria enter the rectum, which can occur through anal sex, or by spreading from nearby areas, it may lead to symptoms like pain, itching, or a feeling of fullness in the rectal area. Some people might also notice a discharge from the anus, which can be clear, white, or yellowish. Occasionally, there may be small spots of blood on the toilet paper after a bowel movement, or even mild bleeding that can be alarming if you're not expecting it. These symptoms can be mistaken for other conditions, so it's important to pay attention to any changes. Gonorrhea can also infect the throat, especially if you've had oral sex with someone who has the infection. Throat gonorrhea is often overlooked because it may not cause any obvious symptoms. When symptoms do appear, they might include a persistent sore throat, redness, or swelling. However, many people with throat gonorrhea feel completely fine and have no idea they're infected, which is why regular testing is so important if you're at risk. Another rare but possible site for gonorrhea infection is the eyes. This can happen if you touch your eyes after coming into contact with infected fluids, such as semen or vaginal secretions. Gonorrhea in the eyes can cause redness, pain, swelling, and sometimes a pus-like discharge. If left untreated, it can even threaten your vision, so it's important to seek medical help right away if you notice these symptoms. In rare cases, the infection can spread through the bloodstream to other parts of the body, such as the joints and skin. This is known as disseminated gonorrhea, and it's a more serious complication. Disseminated gonorrhea can cause joint pain, swelling, and stiffness, making it difficult to move. It may also lead to skin rashes that appear as small red or purple spots, and sometimes even fever or chills. These symptoms can be mistaken for other illnesses, so it's crucial to let your healthcare provider know if you have any risk factors for gonorrhea or have been exposed to someone with an STI. If you notice unusual pain, swelling, rashes, or any other unexplained symptoms, especially if you think you might have been exposed to gonorrhea, don't wait. See a doctor right away. Early diagnosis and treatment can prevent complications and help protect your health and the health of others. The good news is that gonorrhea can be cured with the right medicine. Doctors usually give antibiotics. These are pills or shots that kill the bacteria. It is important to take all the medicine, even if you start to feel better before you finish. Never share your medicine with anyone else. If you are treated for gonorrhea, your sexual partner also needs to be treated. Otherwise, you could get infected again. Always tell your partner and encourage them to see a doctor too. Sometimes the bacteria become strong against some antibiotics. This is called antibiotic resistance. If this happens, your doctor may try a different kind of medicine. Always follow your doctor's instructions carefully. After treatment, wait until your doctor says it is safe before having sex again. This helps stop the infection from spreading. One of the best ways to prevent gonorrhea is to use condoms every time you have sex. Condoms act as a barrier and help stop the bacteria from passing from one person to another. Remember to use a new condom each time. Getting tested regularly is also very important, especially if you have more than one partner. Some people get tested once a year while others may need to test more often. Talk to your doctor about what is right for you. Talking openly with your partner about sexual health can also protect both of you. If you or your partner have symptoms or think you could be at risk, get tested together. Avoiding sex when you or your partner have symptoms is another way to keep everyone safe. Remember, even people without symptoms can still spread gonorrhea. If gonorrhea is not treated, it can lead to serious health problems. In women, it can cause pelvic inflammatory disease, which may lead to trouble getting pregnant. Some women may have long-lasting pain in their lower belly. In men, untreated gonorrhea can cause pain and swelling in the testicles. In rare cases, it can lead to infertility, which means not being able to have children. Both men and women can get infections in the joints, skin, or even the heart. Gonorrhea also makes it easier for HIV, the virus that causes AIDS, to enter the body. This is another reason why early treatment is so important. Do not ignore the infection. Treating gonorrhea early protects your health and the health of those you care about.